Namaskar viewers. So today's continuation of health question and second episode, and it's a wonderful experience and going to be a very enriching discussion with neurologists with us. And today's topic, health of brain, which all of us are very curious about, and on and off we hear many terminologies, but we don't know what it means and how it affects our health. So today, let me very happily and cordially welcome Dr. Sudhir Kumar, a senior neurologist from Hyderabad. And Dr. Sudhir Kumar, not only a neurologist, but on social media, he's sharing a lot of wisdom about keeping the health intact by exercise. So, wonderful interaction that too as well, doctor, because that's more essential for professionals.
Sure. Thank you.
Thank
Thank you for the kind words and introduction.
Doctor, every time there is some sort of discomfort or disorder, and when we go to any physician, first approach is always our the general doctor or general physician. So one common term we hear is "आपकी नस दब गई है," and we don't know what does that "नस दब गई है" means. So what I want to understand from you is there are n number of discomforts, but how do we know that this is particularly a neurological disorder?
नहीं ठीक है बहुत इंपॉर्टेंट क्वेश्चन है तो नर्वस सिस्टम एज वी नो इट इज quite detailed and it starts from the brain then spinal cord then there are nerves in the hands and legs so almost entire body any part of body can be affected by neurological disorders.
Hmm.
So just I'll just mention some common symptoms which are definitely neurological.
Sure, sir.
One is headache. If somebody is getting occasional little bit mild headache, that may be okay. But if somebody is getting repeated headaches on daily basis or weekly 2 3 times, or even the first headache which is very very severe, causing vomitings or any blood vision, double vision, then that is a neurological problem. The second, so that most often is a condition what we call migraine.
Mm.
The second problem of neurological disorder can be losing consciousness. If somebody is having totally normal, suddenly faints, and especially if there is jerking of body,
Mm.
then that is a sign of a disease called fits or
Yes,
epilepsy or convulsions. So that
yes,
again is a neurological disorder.
yes.
And the third common disorder that we commonly see is what is called as paralytic attacks,
Ah,
where all of a sudden the person loses the strength of one hand, one leg. The face also may go to one side,
yes,
may have unclear speech.
yes.
It starts all of a sudden. So that is a definite sign of stroke,
Mm.
and that the treatment is time bound. So there no delay should be done. And then so these are some of the common things. And again, in especially in older people after 40 or 50, if
Mhm.
people start forgetting, so brain, one of the main functions of brain is to remember things.
Mm.
And if somebody's memory is deteriorating, starts declining,
Mm.
so again that's a very important sign of neurological disease. And nowadays in our lifestyle, people need to sit for a long time and look at the computer screen, phone screen. So we are commonly seeing problems with the neck and the back,
Yes,
and from there the pain can go down to the from neck to the hands
yes,
and back to the legs.
yes.
So that is where what you asked that question कि नस दब गई है, तो अगर गर्दन की नस दब जाएगी तो फिर पेन इन द नेक एंड हैंड विल स्टार्ट, और कमर के पास अगर नस दब जाएगी तो दैट विल लीड टू पेन इन द बैक एंड द लेग्स. So
Yes.
that is usually due to slip disc, or in layman terms it is also called sciatica. So these are some of the common things. And just to conclude, चक्कर आना, किसी का
हाँ.
सर घूम रहा है,
हम्म,
that is called vertigo.
हम्म, हम्म.
तो वो ब्रेन से भी हो सकता है, and sometimes due to ear also it can happen.
I see.
So I've just mentioned some of the common symptoms.
Correct. Some terms I came across, like in nervous system, there is a structural problem, there is a biochemical problem, there is a electrical abnormalities in the brain, spinal cord, as you just now mentioned, and other nerves as well. So, which is more common or which is more severe?
See, structural means there is some kind of structural problem in the brain or spinal cord.
Yes, sir.
And basically, those things can be seen on a scan. Like many times when people go to the doctors, they
Sir.
say आपको एक scan कराना है, CT scan, MRI scan. So if somebody has a tumor in the brain or blood clot in the brain or injury causing bleeding in the brain,
Mm,
so or infections like brain fever, so all of these are structural problems where it can be seen on the scan.
I see.
Other group of disorders, the scan will be normal.
Huh.
There, the problems are biochemical,
Huh.
and to be more precise, something called as neurotransmitters. So the brain nerves, they communicate with each other with the help of chemicals, which are called neurotransmitters. And some names are like acetylcholine, norepinephrine, dopamine. So these terms you'll keep on seeing in the biochemistry books also, and in the neurology books also. So
Yes.
if there is imbalance between these neurotransmitters,
Yes, sir.
then the scan may not show anything. And that is the biochemical theory of diseases, and that is common in migraine, in epilepsy, and also in Alzheimer's disease.
Right.
And then if you look at this electrical imbalance, that is typical of epilepsy. So epilepsy, commonly we say it is like a short circuit in the brain nerves,
Mm.
with resulting in abnormal, repetitive, and discharges in the brain nerves, and the person loses consciousness.
Mm. And they get foam and then they also shiver and
Yes, the commonest epilepsy is where the person has violent jerking of hands and
uh,
legs.
uh,
They lose consciousness.
uh,
They have frothing at the mouth. They can
yes,
bite the tongue,
yes.
and this will last for 2 to 5 minutes.
Mm.
And then after that, slowly they recover from that, regain consciousness. But during that time, the breathing may be heavy. The pulse rate and the BP also may rise at that time because they're unconscious. They can involuntarily pass urine also at that time.
Right.
So
Right.
this is the common type of epilepsy called generalized epilepsy.
When we saw the structure when we were in the school, um, I'm talking about non-medical people. We saw that it's very well protected, brain and nerves especially, because you have n number of layers around it, and the skin is on top of it. But still, under which extreme conditions, why would people get a damage in that area? Of course, fall, accidents is understood, but otherwise also.
Yes, you are very correct. See, always there is a debate which is the most important organ of the brain. Is it the body? Is it the brain or the heart?
Mm,
And obviously, when God made the bodies, He thought brain is more important because brain He gave so many coverings.
correct.
So there are three coverings for the brain called meninges,
Yes,
and then we have the very thick skull bone.
correct.
We always say if somebody doesn't listen to us, you got very thick skin like that. But there's nothing to beat the skull bone. And then we have the scalp, skin, and then the hair. So many things. You are right. So possibly, brain is important for us to do many things. Whatever jobs we are doing for student, whatever the way he performs in his exams or studies, and if any scientist is going to discover something new, without brain, good brains, they cannot do anything. So brain is definitely important. Heart is important because it has to pump the blood. It's like a pump, like a machine,
Mm,
and in a minute 60 times it has to contract and send blood to all parts of body, so that's why it's important.
mm,
Now coming back to how brain can get
mm,
affected,
mm,
is that mainly through contiguous structures. When I say contiguous, if any infection in the nose or sinus, it can directly spread to the brain, like fungus infection of the sinus. We may have heard in the black fungus in the COVID days.
yes.
So it was mainly affecting the nose and sinus and very close to brain. So it will erode the bone and then enter the brain.
Oh,
Now also, if somebody has bacteria in the paranasal sinuses, it can spread directly to the brain. Ear infection again can spread to the brain. So surrounding structures, infections can directly go. Even if somebody has infection in the faraway place, let's say in the lung,
mm,
or urinary tract infection, urine infection,
yes.
those bacteria can enter the blood, and the same blood is rotating, circulating in the whole body,
Mm,
including brain.
mm,
So through the blood, also the bacteria can reach the brain. And the second thing is even the air. See, when we breathe oxygen,
mm, mm,
then viruses and bacteria can enter.
mm,
Of course, first they go to the lungs,
mm,
but from the lungs through blood, they again can reach the brain. So that is one of the few methods by which they can reach. And then the direct injury already mentioned. If there is an accident,
yes.
especially if people are not wearing helmets,
Yeah.
and that's why helmets are
Yes.
important. So then
Yes.
the direct injury to brain can happen.
Um, are are neurologists more learned than any other person because they work on a very important part of the body?
See, as a neurologist, I'll be happy to hear that. But the fact is, it's just the other way. But there is no denying the fact that neurology is vast. So if you ask any doctor, those who are doing MBBS,
Yes.
and after MBBS we do MD medicine, where we look at all the systems.
Correct.
At till that level, most 90% of doctors would agree that neurology is very vast.
Mm,
because I said it has. This is the only system where we have to read about the entire body.
Complete
If
anatomy
somebody is a cardiologist, he can just learn about the heart
correct, correct,
and forget the rest.
correct,
Or if somebody is a pulmonologist, he can read about the two lungs and
correct,
forget the rest.
correct.
But neurology is something which can affect the heart also. If somebody has a injury to the part of the brainstem, the lower part of
Lower
brain,
part, yes,
the heart and the lung functions also can get affected.
correct.
So the brain disease can affect any part of the body. So, and the number of diseases also are quite huge. And it is the most tough. See, when I entered neurology about 25 years back,
Mm,
very few treatments were possible at that time.
mm,
So they said that many of my friends and seniors asked me, why you want to become neurologist? Because you cannot treat anything. So then I said, that is why I want to become neurologist so that, I can find some treatments and by the time I, grow in my seniority, treatments will be there. And that's what has happened. In the last 25 years, the most exciting treatments came in the field of neurology. And even today we don't have treatments. Like if you look
exactly,
at Alzheimer's disease and dementia,
exactly, exactly.
still we have nothing of great.
Mm,
So there is still a lot of scope. Muscular dystrophy, where young children they become
correct,
weak, they cannot
correct.
move. There is no cure. So even if young doctors today who are thinking of taking up some specialty, they should aim to
Think
become
about
neurologist.
neurology. Mm-hmm.
And coming to your specific question, it is not vast.
Mm,
See, like if you feel it is tough and stay away from the subject, it becomes tough.
true.
But if you spend some time, and it's only 6 months time, see any doctor, if they spend 6 months time in neurology, and especially if they come to me for training, definitely, or any neurologist for that matter, they will become experienced.
Wonderful. So that's the promising word. Wonderful. Um, Doctor, as just now you mentioned, you know, among the senior citizens, the elderly people, um, dementia is a very common issue, and it can extend to very dangerous conditions also, like walking out of the house, not remembering anything, locking themselves inside, and not knowing that they are locked themselves. It's very worrying point. Um, Now, I don't want to say that is there any treatment, but what I want to ask is uh, how can we delay that process?
Yes.
Today's modernization is making it even more challenging.
Yes, definitely. So one is dementia, how to delay it, and that is what we have to do because we always know that prevention is better than cure. And especially for Alzheimer's, when there is no cure, the
Mm,
only thing we can do is prevent it or delay it.
delaying
And
it.
there's so many things one can do.
Mm,
Just like how we keep muscles active by exercising,
yes, yes.
by using brain, one can keep the brain active. So, because I have seen that many people, when they so-called retire, like in India, retirement age is
Mm,
60 or
mm,
65 or whatever.
mm.
So, so retirement does not mean mentally retiring.
Uh,
So if somebody stops working,
mm,
then and they don't use the brain, they just start watching TV or something useless,
true.
then the brain can degenerate. So
Yes.
the first thing is to keep the brain engaged and busy in something.
Mm.
It need not be for money.
Uh,
It can be something for your passion where you need to
yes.
think
Something
and
creative, something
something
creative.
creative. So even if those who have retired,
Mm,
they should use their experience and do something. Or when we are working, we always have a lot of interest, but because of the working schedule, we
correct,
can't do those things. So
correct.
that is a time to start, doing things for their own passion and interest.
Mm,
So keep the brain busy for 3 to 4 hours per day.
mm,
Second thing is to keep engaged with the society. So
mm,
it's found that those who live alone
mm,
as a loner,
mm,
loneliness, it is a
mm.
risk factor for dementia. So
Uh,
they should live with a family.
mm,
They should have friends, talk to them, or go for social gatherings and functions. So
mm,
those who are social,
mm,
they have less risk of dementia.
mm, mm,
Third is physical activity itself, because
mm,
any physical activity, whether it is at old age,
mm,
people cannot do strenuous, but at least 30 to 40 minutes of
mm,
walking,
mm,
if they do, or say 10,000 steps in a day,
mm.
that itself will delay the dementia and reduce the risk of dementia.
And
And
also, I think family should also take care of this part by keeping close contact with elders in the family and
yes, yes. See, our Indian values are the best. In India, parents and children stay together. It is
correct.
not like the West where
Yes.
parents are sent to old age homes
Mm,
and children live separately. So, living together with the children, this thing always is useful, and because they need to keep busy. If you have, especially if they have grandchildren,
Ah,
they will make sure that the body and the mind are kept busy. They have to keep running behind them. They will take them for a walk and things like that.
correct.
They will ask some questions for which the grandparents have to think and answer.
Yes.
So all these things are useful to delay dementia or reduce the risk of dementia. And not to forget the food. See, many times people when they get old, they say, "Why should I eat healthy food? Let children eat that."
Okay.
Not like that. So everybody should have good consumption of dry fruits,
Yes, food.
and especially this blueberries. These are very good for brains.
Okay.
Those who are non-vegetarians can eat fish, which is again good for brain. So healthy diet and vitamin B12 deficiency could be common in vegetarians, which can also cause dementia. And so those who are non-vegetarians, they'll get the good source. If not, then there's no harm in taking B12 supplements. For those who are pure vegetarians.
Mhm. That's very important point. Even diet makes a lot of difference in very true.
See, brain aneurysm, what it means is it's like a balloon-like outpouching in the blood vessel. So in the brain, we have arteries which supply the blood to the brain, and the veins which drain the blood back to the lungs for purification. So if there is a dilatation in the artery like a balloon, that is called aneurysm, and it forms on its own. It is not related to the job or the stress.
Okay,
So
okay.
it can happen to anyone, and the only risk of that aneurysm is that it can burst. And suppose 100
Cause
people are there with
hemorrhage.
aneurysm. Out of 100, two people it can rupture
Oh,
every year.
oh,
Every year, two people. So if suppose somebody is now 30 years old,
mm,
then and if he lives for 50 more years, then 100% chance that it will rupture in one of those years, because 2% rupture risk is there per year. So that is the risk of aneurysm. And most often it is diagnosed after the it has already ruptured and caused bleeding, because if it is small outpouching, it may not lead to any symptoms. So that is the thing. So it is something we do pick up. Somebody who has a scan for something else, it can get picked up also. So, but then many times it does not get picked up, because if those who are normal and healthy, why would they go for scan?
correct.
And none of the health checkups have brain scan in that package. The health checkup package includes only up to the heart,
Yes, yes,
because they don't feel that brain is
yes.
important. So,
Very
so
important.
no health package has brain tests.
Exactly.
All the tests are for heart, kidney, lungs, liver.
Mm.
Everything is checked except the brain.
But
So
then I have a sorry to interrupt you, but then I have a very serious question here. Like all the labs and all the hospitals, why can't they push for things about this also as a test package? Because brain, as you said, if it is controlling everything, why not have
I
that
think
scan?
there are two reasons for that. One is that doing CT scan,
Mm.
uh,
Cost limit.
one is the cost. Second is it has radiation. So there'll be one ethical question will come: why expose to radiation? And if you do 100 scans, only one may be showing a problem. And so if we do MRI, there is no risk, but MRI is even more costly. So health checkup packages will be around 2 or 3 thousand rupees, and the MRI itself will be 3 to 4 thousand minimum. So it will double the cost. So I think cost is the main factor, but we should have some kind of
Ah.
screening questionnaires. Okay,
Mm,
saying that, do you, like in the beginning you asked me what are the symptoms of neurological diseases.
mm.
So if patients are saying yes to any of those symptoms, those patients can opt
Can
for
be
brain
referred for the scanning. Yes.
scanning, yes, or neurology consultation, or something, and then scanning.
Correct, correct. Doctor, very common term in nowadays, you mentioned that in the beginning as well, migraine. Is it purely a lifestyle issue or there is something else behind it?
No, migraine, the exact cause of migraine nobody knows, but the lifestyle factors, they increase the risk of migraine. The number of headaches can increase.
Hmm.
So in that, the common things are sleep. If somebody is having, sleep is disturbed or they don't sleep properly, the next day migraine headaches can be more. Second thing is any amount of stress. So nowadays, many youngsters, they take job stress, family stress, financial stress, personal stress. Any stress can increase the risk of headaches. And third is not eating food on time.
Ah,
So youngsters are busy in working longer hours, no time to cook food,
mm,
and also sometimes they rely on junk food. So many of
ah,
the junk food like Chinese food, cakes, chocolates,
yes.
these can increase the risk of migraine. So these are the lifestyle factors which trigger the episodes of headache. And other things which are not controllable are exposure to loud noise or sunlight, which can also trigger.
I think more of a time. I think it is more of a laziness that is causing not you eating nutritious food or home cooking, and
I think more than
chemical.
laziness, it's people are working longer hours.
Mm,
So because the expectations are high, they want to earn more and own a house at the age of 30. Our parents, they were happy, if they got home at the age of 60.
true.
But today at the age of 30, they want to take loan and, buy a home.
Yes.
So we should not have unrealistic expectations. If the salaries are good enough that you can afford a house, buy the house. But to take 50, 60 lakhs loan and then work 12 to 16 hours to pay the EMIs, it will take a toll on the health. Migraine is one of the things, but other things also like high BP, risk of heart attacks and strokes are increasing in youngsters
Yes.
because of
Yes.
more stress and sleeping less. More if those who sleep less than 6 hours is a risk factor for many lifestyle diseases.
But then desires
So
are there on top of
the work
everything.
should be about 8 to 9 hours.
Yes.
Yes. And then we have to have time for proper timely foods, timely sleep, exercise, family time, relaxation time, leisure time. All this should be there.
Very pertinent question now, doctor. Another concern area, which is a brain stroke, and which causes a lot of damages. So I would request you that please educate us on what is the men women ratio here, who is more potential candidate. Second, how the high blood pressure and diabetes plays a major role in this. Third is, as you are also echoing again and again, lack of exercise or active lifestyle. And fourth one is birth control pills. So these are some factors which I have come across.
Yes.
Please,
I
please
think,
support.
see, brain stroke means paralysis or
Yes.
lakwa. So the common symptoms are, we can remember by the term FAST, fast.
Mm.
So in the fast, F means the face deviates to one side.
Mm-hmm.
That is facial weakness. A stands for arm. So
Arms.
if we ask the arms to be stretched like this, one
Ah,
side arm will start falling. So
okay.
weakness of the arm.
Okay.
And then S is speech. The
Ah,
speech either is not clear or they cannot
disability.
understand.
Mm.
And T stands for time because the treatment of stroke should be given at as early as possible. And the last is 4.5 hours. Beyond that, treatment are not effective.
Oh,
So that
oh,
is the main thing.
okay.
And as you said, the risk of stroke we can classify into modifiable and non-modifiable. Some things we cannot change. So one is the risk is more in older people. We cannot change our age. Second thing is, as you asked, male-female ratio, it is more common in males overall.
Mm-hmm.
I think the major risk factor, maybe all the risk factors which are there, like say smoking,
Mm,
alcohol,
mm,
those things are possibly more common in males.
mm.
And but you know, after menopause,
Mm.
the risk of stroke in women also is almost similar to men.
Correct, correct, correct.
The estrogen is a hormone which protects women against stroke, so
Yes.
the prevalence may be lesser in below 50
Effective.
year age. But in that below 50 women also there are some specific situations where the risk of stroke may be more. And as you mentioned, OCPs, oral contraceptive pills, which are used for birth control as well as treating periods irregularities and sometimes for polycystic ovary or various conditions.
Mm,
So those pills also contain estrogen progesterone combination,
mm,
and that slightly increases the risk of stroke. And if the woman is also smoking nowadays,
mm.
it is a fashion among young
Yes.
women to
Yes.
smoke
Yes.
because they want gender equality. So why only men should smoke? Why only men should drink? So they are competing with men in good and bad.
True.
I would have felt that, because women are always more intelligent, like, mothers educate children much more than fathers. But today's mothers, they have taken to smoking and drinking, which is not a good thing. It should reduce by everyone, including women. So
Men
if
and women both.
women are taking OCPs and smoke, that's a deadly combination. Then the risk
Mm.
of stroke is very high in them. And otherwise, uh, the risk is slightly high, not very high.
Mm,
Because so if OCPs are required by given by prescribed by a gynecologist,
mm,
then there's no harm in taking it. Okay. But just as a fashion, many times I hear women they want to postpone the periods
mm.
because some function is there or
Correct.
some or they're traveling. So that and or sometimes they had unprotected sex, so they want to have MTP. They will just take some what is called as morning after pills. So those things are not healthy because frequent use of hormones can increase the risk of stroke. Also during pregnancy, see, pregnancy and the postpartum period is little different from the usual periods for women. So where the hormonal imbalances occur. So just after delivery, some women can lose blood, and also little bit of dehydration can be there because delivery is not a very easy process. So
And
they
high
can,
sugar also, I think.
yes, some women can get gestational diabetes. Also something called as pregnancy induced hypertension. BP also can go up.
Wow.
So that last trimester of pregnancy and first 6 weeks after delivery is a slightly high risk period for women to get strokes. And the specific stroke of the brain veins called venous thrombosis, cerebral venous
Mhm.
thrombosis.
Mhm.
But luckily, these things are not common. But just for education purposes, I'm telling. So women should not get scared that once I get pregnant and have delivery, all these things will happen. These things are uncommon. But if somebody has these symptoms, it should be treated. That's all.
Then, in general, also now we are not talking about men and women as such, but the high BP especially causes more risk factor for the stroke.
Yes. So the commonest risk factors, one is high BP. So any BP which is more than 140 systolic and lower 90, so 140 by 90 or more is a definite risk factor for stroke. Second will be sugar. So sugar, we have to look at fasting blood sugar and also something called HbA1c, which is last 90 days average. So if
Mhm.
HbA1c is more than 7, it is a risk factor for stroke. Cholesterol, so if total cholesterol is more than 200, LDL, which is bad cholesterol, more than 100, triglycerides, if it is more than 150, so cholesterol will come number 3. And then other things I mentioned: smoking, alcohol abuse,
Yes.
which will increase the risk of stroke. Sedentary lifestyle, so those who sit for a long time, say more than 6.5 hours. So most jobs are sedentary. So in the jobs also, people should make an effort to get up after 1 hour, take 1 or 2 minutes walk, and then come back.
Any particular diet you want to suggest to people to keep the neurological disorders away?
See, the neurology depends on the risk factors. So we have to keep weight under control, sugar and BP away. And so for that, the best diet is low carbohydrate. So sugar, just make it zero. We are used to having sweets. Every state has got their own specialties of sweets. So we have to, the sugar craving, we have to stop. Sugar is addictive. If somebody eats, if you get one box of sweets, you can't stop at one. In the night at 11 o'clock, you'll feel hungry. You'll go to kitchen, open the fridge, have one more. So the best answer is that don't buy the sweets. If somebody gifts you, you also gift it to somebody else. Don't bring it home. And and then in the tea, coffee also, the best tea is without milk and without sugar. So if you're putting milk, put little bit of milk, but definitely no sugar. And then second thing is, as I mentioned, less reduce the carbohydrates. So all the rice, roti should be less. Increase protein intake, and then have more of fruits and vegetables. So they are also very good for the brain. Fresh fruits, the packaged foods. Many people have packaged food, what is called ultra processed packaged foods.
Yes,
They are
yes.
not healthy. They are high sugar. They have preservatives, which are chemicals. So bad for health, bad for brain also. Risk of dementia also is more with packaged foods. So more of fresh fruits, which are perishable. If something says it can last for 1 year, definitely don't bring it
Not good
home.
for health.
Just leave it in the shelf itself. All the packaged juices,
Mm.
when the so any packaged juice also is having only sugar and no nutrition in that. So the best is to have whole fruits. Those who can't have whole fruits, then fresh fruit juices without adding any sugar. And the worst is having packaged fruit juices.
Canned food.
Soft drinks also avoid. Soft drinks, again, mainly sugar and nothing else. Even the diet soft drinks also are not healthy.
Not advisable at all. Right. And that's not our culture. That is just our
Correct. Yeah,
guidelines.
it's all we are just copying the West.
That's it.
But we should copy the good things from the West. See, there are the people who cycle a lot, who walk a lot, who run a lot, but we don't copy all those things. We'll just copy what they eat.
Yes. Yes. So, bottom line is eat healthy, exercise daily, and keep the positive approach on all the time. Thank you very much for your time. And I'm sure it was enriching to me and it will be for everybody. Thank you so
Sure.
much. Wish you all
Thank
the
you.
best. Thank
Yeah.
you.
Thank you very much. Thank you.